Hello, we did our dissemination project on a targeted and effective screening tool to identify patients with alcohol misuse or addiction using the audit screening tool. I am Lauren Pickett.
And I'm Missy Henrich, and we're missing Kayla Kendall, Mary Worth, and Dylan Fox, who are here to practice with and do the video with us.
So, just as a background of practice, why do we screen for alcohol abuse? Alcohol is a big part of our society. You can buy it anywhere. You can go to the bars when you're 21. It's a part of our American society. Heavy drinking often goes undetected for this reason, and drinking problems are common in society today. So what actually determines an alcohol abuse problem? For a male, 14 alcoholic beverages in a week or 4 in a day constitute an alcohol abuse problem. However, for a female, 7 in a week or 3 beverages a day can be considered an alcohol abuse problem. These are problems related to alcohol consumption. So what is the clinical problem here? The clinical problem is the effects of alcohol on healthcare outcomes. So other than the dangers of drinking and driving or the acute problems that binge drinking can cause on your body, alcohol abuse is related to poor health outcomes such as disability, mortality, morbidity, community-acquired infections, healthcare-acquired infections such as sepsis and pneumonia. So it is very important to use this audit screening tool when assessing patients in the hospital setting to identify patients that do have alcohol abuse problems to provide adequate care for them.
So a little bit about the audit screening tool. It stands for Alcohol Use Disorder Identification Test, and it's a questionnaire, and we decided we were going to use the interview version to identify alcohol addiction rather than having the patients fill out a self-questionnaire so that we can kind of maybe prompt them if they need a little bit of help answering their questions. So the audit screening tool has a total of 10 items ranging from things having to do with hazardous alcohol use, harmful alcohol use, and dependent symptoms. And each of those 10 items range up to 4 points each, depending on what they rate themselves for each of these categories with drinking. So the interview process takes about 2 to 4 minutes, and you have to begin by saying, now I'm going to ask you some questions about your use of alcoholic beverages during the past year. And you want to give them a little bit of an idea of what an alcoholic beverage is. So you need to standardize the drinks such as beer and wine or vodka. So the scoring takes a couple of seconds, and a score of 8 or more indicates hazardous or harmful alcoholic use and possible alcohol dependence in which you would need to further your interventions for the patient. And the score goes up to a total of 40 points. So our project aim is to successfully use the audit screening tool to detect alcohol addiction in patients within a hospital setting. Our methods include a number of evidence-based practice approaches, one of which is primary research studies. Some advantages to primary research studies are they are the most up-to-date information and research. They are accurate and very reliable to use the information, and they offer in-depth comparisons between the primary research studies as well as in-depth analysis for the best evidence and to make the best clinical expertise judgments.
So why we chose audit? Throughout our evidence-based research, we found that audit screening tool was the most effective screening tool compared to another screening tool for alcohol abuse, such as CAGE. It's the most widely run because audit can detect a broader population, such as early alcohol use to alcohol dependence and addiction, whereas CAGE can only detect alcohol dependency later on in the disease process. So this gives the audit screening tool an advantage over other screening tools such as CAGE. And our goal is to identify alcohol dependence as soon as possible to have an improved treatment and better outcomes. This is why we chose audit as our screening tool of choice throughout this research project.
So for our implementation plan, we decided we were going to do a pilot study on one adult medical surgical floor of one hospital to determine the effectiveness of audit. So before this full implementation for each patient, there will need to be staff education around the use of audit as well as the scoring process to ensure that there's a common and standard implementation plan around the use of audit. And so the nurses will be conducting the screening during every admission assessment for each patient on this medical surgical floor, and it will become a part of the standard of care for each admission process. So the patient score on the audit tool will generate a recommendation for to follow up for certain interventions that they may require if they need rehab or any help with their alcohol addiction, or even just a little bit of information to tell them the risks of if they continue their alcohol use. And nurses play a key role in the implementation plan because of our relationships we build with patients and the general acceptance by the patients of our questions during the admission process. And this is a picture of the audit screening tool. So it shows all of the 10 items, and it gives a little bit of direction, such as in question 3, if you answer never to if you have 6 or more drinks on one occasion, then it will have you skip all the way to question 10 so that it can save a little bit of time if they don't have 6 or more drinks in one sitting.
And then our methods for evaluating our outcomes. So we plan on having the staff, the nurses, completing a chart audit after 1 month of implementing the audit screening tool for each admission. We have a benchmark of 85% of the nurses using the audit screening tool for each admission. And then if our compliance is low, if we have like a low benchmark, lower than 85%, we plan to educate the staff and have more staff use this and assess what they're doing wrong and how to improve. And that's it.
That is all. Thank you very much.